In my NIDEK suite, I have specular microscopy. I believe that in every single case, to have specular microscopy is very important. And I can get that with the CEM device from NIDEK. And it's very important to measure it pre and post-op, especially to see if I'm working correctly inside the eye and I'm not losing too many endothelial cells, but also to understand that there's many patients that you clinically see correctly, but they can have many manifestations that you can only see doing an endothelium count of the cells. So I think it's very important for you to have one good machine, very easy to use. It gives you the metrics in a very easy to read way. Actually, you can also train your patients and educate them on why it's important to have this or that technique, because they can understand clearly what's going on in their endothelium. I think it's also very important for you to measure your results between the pre and the post-op to see if your surgical technique is correct.